Chapter 20, Loss and Grief. Life is a series of situations, experiences, challenges, joys, and losses. It is a dynamic process that requires continual adaptation and adjustment. Life is filled with gains and losses at every level. A loss is an unavoidable part of life, and everyone must cope with these. Emotional reactions and their resilient behaviors are learned from childhood observations and experiences with individuals. A loss can be real, which is an actual threat or a situation that is based in reality. An example would be a family whose home burns is experiencing an actual loss. Potential losses may be defined by the individual experiencing them. For example, an individual who is facing a layoff is coping with the possibility of losing the means of employment and providing for the family. An imagined or perceived loss. An example would be a newlywed who loses her breast to cancer and then imagines that her husband will reject her. Toddlers live in a world that is self-centered. As long as the loss does not concern them, they don't experience the loss. Preschoolers deal with loss by using magical thinking. They believe losses that they experience are caused by something that they said, that they did, or that they thought. Younger school-age children feel guilty and still have some blame for losses. They may start to blame imagined or unseen characters for causing the loss, particularly when it comes to death. The concept of the permanence of death occurs in children around the ages of 9 to 10. They know that the individual is dead and never coming back. While younger individuals tend to think concretely, adults are able to perceive things in a more abstract manner. Grief is considered a set of emotional reactions that accompany loss. Mourning is a process of working through or resolving grief. Bereavement is a behavioral state of thoughts, feelings, and activities that often follow a loss. The period of grief and mourning after a loss may be intense and painful, may last for a short time, or remain as a deep emotional scar. The feelings of loss, grief, and mourning are deeply personal, and every individual has their own way of coping with these emotions. There is no right way or wrong way to grieve. Denial can work in a positive way by decreasing the blow so that individuals experiencing the loss can continue throughout the process. The yearning stage is when an individual moves out of denial and realizes that the loss has occurred. This is a very critical time, as individuals can begin to feel that they just may not be able to take it anymore and may become very disorganized and restless. Angry family members may accuse the nurse or the doctor of neglecting or mismanaging the patient's care. As medical individuals, these people need to understand that this is part of the grieving process. The third stage of grieving is usually when depression and identification set in. The individual will realize what this loss means to them, and gradually the person will renew their interest in other people as well as activities. The grieving releases the bereaved from one interpersonal relationship to new relationships with others that are living. An unresolved grief reaction accounts for many physical and mental symptoms that are often seen. Bereavement-related depression often happens within a year of death. For example, Harriet lost 35 pounds due to her loss of appetite after her husband passed away. She stopped getting dressed and became worse, wearing the same housecoat all day. When she would go to bed, she would pray that she would not awake in the morning. Complicated grief, the example for this would be that Elizabeth stopped volunteering and then going to bingo after her husband's death. She would spend all day looking through family albums. She kept all of his clothing, and when she did talk to the few friends that she still had, her only topic was what a wonderful husband she had. Many nurses work with clients that are dying. Some nurses work with them daily. These nurses form relationships with their clients that develop into an understanding and rapport. The focus is on the client, and the caregiver will act therapeutically, but the bond between the two will grow into a relationship. When that relationship is lost, even when the loss is expected, the nurse will grieve, and it is a necessary process for health. The diagnosis of a fatal illness or condition is received routinely with disbelief and shock because it is a true crisis. This is a time of uncertainty. Both the patient and the family are struggling to cope with the illness effects, and then its outcome. Crisis interventions may be very effective during this stage. School-age children and young adolescents begin to become aware that death is irreversible. Parents need to communicate with the child, explain dying and what happens in a truthful and honest manner. The way that an individual reacts to a terminal illness is often determined by their beliefs about death, as well as their past effective coping skills. Individuals will make major changes that are necessary to prevent a condition from becoming fatal. Some individuals value their present ways of living too much or feel that the extra time gained may not be worth the work that is required. The decisions about one's remaining time belong to and should be made only by the individual that is affected. Each culture as well as community views death differently. Catholics believe that after death, the bodies and souls of the dead will be reunited after the end of the world. Jewish individuals will wear a black band on their upper arm for 30 days following the death of a family member to show that they are in mourning. African Americans are more likely to attend funerals no matter the time of day and often go to the burials. The resistance stage of the dying process is when the individual fights the issue through denial, avoidance, anger, and bargaining. The working or the review stage, this will broaden the consciousness as the individual reviews their life. The resistance will disappear and the individual will begin to deal with unfinished business. They will reclaim a part of their self, and they will become more in tune to themselves of the present rather than of the past. In the acceptance stage, the individual is comfortable and acknowledges death. They can discuss it calmly and peacefully. Increasingly, greater amounts of time are spent focusing inward, moving all their energy away from reality. There are various problem statements that are related to death and dying. Physically, there can be risk-prone behaviors, caregiver role strain, ineffective coping, knowledge deficit, imbalanced nutrition, insomnia, social isolation. Psychosocially, there can be anxiety, decisional conflict, denial, grieving, hopelessness, powerlessness, impaired social interactions. Hospice care is provided to individuals that have a terminal illness. The goal for hospice is to make the individual's remaining time as meaningful as possible, as well as painless as possible. There are various signs and symptoms that are associated with one that is dying. There will be coolness, color, and temperature change in the hands, arms, feet, and legs. The peripheral circulation will diminish to facilitate increased circulation to the vital organs. There will be an increased amount of sleeping for the conservation of their energy. The individual may become disoriented, confusion of time, place, or person. There may become incontinent of urine and feces due to increased muscle relaxation. There may become congestion of the lungs due to poor circulation of body fluids, immobilization, and the inability to expectorate secretions that cause gurgling, rattles, or bubbling in the lungs. The individual may become restless. This is due to metabolic changes as well as a decrease in the amount of oxygen. There will be a decreased intake of food and fluids. There will be a decreased amount of urine output because of the decreased fluid intake. There will also be an altered breathing pattern due to the metabolic as well as the oxygen changes for the respiratory center. Loss is a part of the life cycle. The coping mechanisms can be effective and result in growth and healing. The nurses who provide hospice care for the terminally ill patients and their families provide great support for these individuals.